Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today we're refreshing our memory on balance billing and some of the prohibitions against balance billing. We have a couple links for you, including some recent articles that you might find interesting, and you can visit those at any time by clicking on that information button you see at the bottom of your screen. First, let's revisit what we mean by balance billing. It's a practice that refers to a physician's ability to charge a patient for an outstanding balance after the insurance company has already submitted its portion of the bill. Now, this comes into play a lot of times when people are going out of network. You might be surprised that you are not being seen by an in-network provider, and therefore you will get billed for those out-of-network charges. That's above and beyond what was the covered service. That is the balance of the bill that can come and be submitted to you. Now, sometimes this happens by accident. People either don't know that they were out of network, or the insurance company actually contributed less than what a patient was expecting. But there are instances of balance billing that are inappropriate and not a surprise, but they should not be happening. The prohibition on balance billing exists mostly in the scenario of public benefits. If an individual on Medicaid, for example, goes in to see a provider, they should not be billed for the balance of the service beyond what Medicaid pays. Now, there are a couple exceptions to that, but that is the general rule, that patients on Medicaid cannot get the balance of the bill beyond what Medicaid paid billed to them personally. Now, generally, also, a healthcare provider cannot bill patients the difference between an allowed charge, which is usually a charge that's negotiated by an insurance plan, and a full charge. So if your insurance plan negotiated that a visit, an office visit, would be $100, and your insurance plan negotiated that down that they would compensate the provider $70, now would be considered paid in full, that provider can't turn around and charge the patient the additional $30 to cover that $100 visit. Those are prohibitions on balance billing, usually in the area of Medicaid or in private insurance where there has been a negotiated cost by the plan. Now, we said that's generally the rule for Medicaid. In Wisconsin, it's actually a Class H felony to balance bill a Badger Plus or Medicaid recipient, or to knowingly impose direct charges upon a recipient in lieu of obtaining the payment from the Badger or Medicaid source. The exceptions are that the services were not covered under the applicable benefits plan, and it's not an or, and the recipient was advised of this prior to the delivery of service. Now, this second bullet point is usually where the rubber meets the road. It could be that the patient doesn't learn until after the service was delivered, not before receiving the service, in which case this would be something that definitely would be appealed, and then the provider would be on the hook for that potential felony charge. Network contracts usually will prohibit providers from billing patients the difference between the allowed charge and the full charge, but there is an exception here again, and that's that example we started with, out-of-network providers. There is no contractual obligation, so even if it is a negotiated cost, if you're seeing an out-of-network provider, you can be billed the difference. This is where the word surprise medical bills comes up. You've probably heard that quite a bit in the news, in your own instances of receiving care. Patients can be liable for the balance bill in addition to any cost sharing that might otherwise apply if they are seeing an out-of-network provider. Where is this most frustrating? If you're in an emergency room or if you're in a hospital and you are in network, but a physician or an emergency room personnel, staff, or specialist comes in and works on you, and they are technically an out-of-network physician at an in-network facility. This happens all the time. That balance bill is technically appropriate. There are states that have passed laws, however, that are making this not appropriate, that have said that's enough, we can't allow that. There was no notice to the patient that they were being cared for by out-of-network providers, even though they were following the rules and went to an in-network facility, and in some cases might have not even been competent or could have been incapacitated at the time of service delivery. Wisconsin has not yet passed one of these surprise medical bill laws. Parts of legislation passed under President Obama started to chip away at surprise medical bills, but it didn't go far enough. There is hope that the new administration might continue that lead, and there is pressure from a number of sources to try to continue the prohibition on balance billing and to get rid of surprise medical bills. We'll keep you posted on those, but in the meantime, you can read some of the sources that talk about surprise medical bills, balance billing, and prohibitions on balance billing. Thanks for joining us.